So our topic today is ostomy education for nurses on surgical floors. This is our evidence-based practice project for Group H. The members of the group are Amanda Rees, Dania Tenori, Dewey Susanti, Lindsay Santos, and Sarah Romero. Our topic identification and background. We felt that this project was very important because there's a large percentage of the population who receive ostomies, and having an ostomy presents patients with a new set of challenges. It creates profound changes to their lives, both physical and psychological. Patients with stomas report an overall lower quality of life, which is why it's so important for nurses to address the need for education in this patient population. Patients have reported being dissatisfied with the postoperative ostomy teaching made available to them. Nurses have expressed lack of knowledge and confidence, as well as personal appearance and understanding when working with patients with ostomies. And so it's very important to have nurses that are knowledgeable in ostomy care so that they can pass this knowledge on to patients and that they can start being hands-on from the beginning and familiarize themselves with, the nurses need to familiarize themselves with the psychological implications of living with an ostomy because this can help improve both patients' and caregivers' quality of life. There's a need for nurses who can teach patients to care for their ostomy pre and post surgery to help boost patients' confidence in caring for them, improving their quality of life, and thus reducing incidence of hospital return visits and infection. Patients also report being more willing and able to follow their plan of care when they feel they are receiving enough support, both emotional and educational, from their nurses post-operatively. So our clinical question in the PICO format is, does providing ostomy education for nurses on surgical floors reduce patient post-operative complications, return hospital visits, and improve patients' quality of life? The stakeholders are patients with ostomies, caregivers of ostomates, and nurses working on surgical floors caring for patients with ostomies. The impact of practice change, the biggest one is obviously improving quality of life of patients with ostomies and their caregivers. It would help nurses working with this particular population better understand the problems, both physical, psychological, and emotional, associated with having an ostomy. And educating nurses on ostomy care will increase patient and caregiver knowledge and understanding of how to care for an ostomy, thus reducing rate of skin infections, return hospital clinic visits, and increase plan of care compliance.
And what is the systematic search? Systematic review, according to Lobiondo, Wood, and Haber, is summation and assessment of research studies that test similar research questions. Our clinical questions that guide our research: does providing ostomy education for nurses on surgical floors reduce patient postoperative complication, return hospital visits, and improve patient quality of life? For this project, we use search engines CNEL, PubMed, and Cochrane. Search inclusion criteria includes full-text English articles that less than 10 years old, preferably, and topics that highly relevant to clinical questions, which is ostomy care, ostomy teaching, ostomy education. And the article must be evidence-based practice. It also includes meta-analysis, clinical trials, systematic review, and phenomenological study. Our EBP project uses integrative review methods to do research evidence search. Review research literatures in particular focus area. Total of 16 EBP articles reviewed, integrated, and synthesized. Literatures included qualitative and quantitative studies. There is no statistical analysis, and EBP literatures are graded for quality, strength, and level of body evidence.
Once we read the individual articles, we decided which level of evidence the research article provides and how well the study was designed and executed. We graded level 1, evidence from a systematic review of all relevant randomized controlled trials or evidence-based clinical practice guidelines based on the systematic review of the randomized controlled trials. We gave a level 2 to articles that had evidence obtained from at least one well-designed randomized controlled trial. We gave a level 3 to evidence obtained from well-designed controlled trials without randomization or quasi-experimental. We gave a level 4 for evidence that was well-designed, case-controlled, and cohort studies. We gave a level 5 to evidence that was provided from systematic reviews of descriptive and qualitative studies. We gave a level 6 to evidence from a single descriptive or qualitative study, and a level 7 for evidence that was obtained from opinion of authors and reports of expert committees. Along with deciding the level of evidence, we also graded the quality of evidence using a 3-point scale. We gave articles good that had evidence that included consistent results from quality design, well-controlled studies in representative populations that directly affects health outcomes. We graded a level fair for evidence sufficient to determine effects on health outcomes, but the strength of the evidence is limited by the number, quality, or consistency of the individual studies, generalizability to the routine practice, or indirect nature of the evidence on health outcomes. We gave a poor grade to evidence that is insufficient to assess the effects on the health outcomes because of limited number of power of studies, important flaws in the design, conduct, gaps in the chain of evidence, or lack of important information for health outcomes. Similar to grading the quality of evidence, we graded the strength of the body of evidence. A grade A went to articles with at least one randomized controlled trial as part of the body of literature of overall good quality and consistency addressing the specific recommendations. We gave a grade B to articles that were well-conducted clinical studies, but no randomized clinical trials on the topic of recommendation. And we gave a grade C to articles that had expert committee reports or opinions and clinical experiences of represented authorities. This grading indicates that directly applicable clinical studies of good quality are absent or not readily available. The method we used to critique the existing EBP guidelines was we addressed a series of critical questions, which included we wanted to ask if the date of the publication was current, was the author clear and appropriate with the guidelines, was the type of evidence used to formulate the guideline appropriate for the topic, was the guideline well referenced and comprehensive, and we also wanted to know who funded the guideline development, along with other questions on there.
The synthesis of the research can be referred to through the literature review grid at the link below. Summary of the research findings. What we found in some of the articles were that early onset of quality ostomy education lead to best results, in addition to superb nursing skills with ostomies. For the gathered data and research, the quality of life of patients with stomas are significantly decreased, more so in cancer patients and women. Women, in specific, struggle with intimacy with their partners after the stoma has been placed. Nurses play a significant role in the likelihood that patients will follow up with care for their stomas. There are numerous ways nurses can build rapport with patients, such as through empathy and sensitivity. Nurses should build rapport to make patients more comfortable and to reveal in what areas the patient is struggling with in regards to the stoma. This is so nurses can help the patients deal with the parts that they are struggling with. Patients respond best when they are satisfied with their level of care during hospitalizations, which lead them to more motivation in taking care of themselves. A good way of providing ostomy education would be using DVDs as well as written supporting materials. Nurses should also provide education to the patient's spouses, caregivers, and significant others so they can be more accepting and to increase their confidence when caring for them. Nurses can recommend effective coping strategies such as laughter and support groups so patients don't feel so alone. Nurses enhance strategies in education has the potential of promoting patients with stomas to take care of themselves and to come back for a follow-up. Nurses need to be educated on the holistic patients in order to cover the bases and promote better outcomes.
The recommendations are based on the following ideals of nursing care. Providing effective education is vital to ensuring proper self-care and self-management of complications, as well as psychosocial adjustment for patients with stomas. Medical advancements and shorter hospital stays mean pre-operative education is imperative. Before information can be imparted to the patient, staff nurses must be proficient and confident of their ability to properly deliver stoma care. Hospitals must institute training programs that empower staff nurses with the necessary education and skill set. These programs should be instituted on an individualized basis and be suited to fit the needs of the greater healthcare organization, taking into account factors such as staffing shortages and time constraints. Some of these examples are shadowing programs in which the wound ostomy nurse precepts nurses during stoma care and patient education, mandatory training held on off days to ensure attendance. Training covers anatomy and physiology, proper care and the management of common complications, as well as the skills lab component. A series of short, single-topic classes held during work hours on med-surg units. Nurses learn gradually through attendance at topic-focused courses. Pre- and post-training surveys will be collected in order to obtain participant feedback and maximize overall effectiveness of the nurse training programs. Quick reference tools will be supplied to reinforce education of both the nurses and patients. As far as educating patients, the humanistic theory will be employed, which states that which is based on concepts of openness and mutual respect in order to promote learning. This will help facilitate patient readiness and ability to learn, including psychosocial adjustment. Also, the social learning theory, which states that people learn in the social context through observation, imitation, and modeling, will be employed to teach patients practical skills.
Proposed guidelines. In addition to clinical skills, nurses should be taught that early practice is the best practice. Nurses should implement stoma education even prior to procedure. This will promote best outcomes in patient understanding of stoma care. Rapport leads to desire. Building rapport is essential with stoma patients in order to promote care satisfaction and have patients wanting to come back for a follow-up. Your surroundings mold who you are. Education of family and friends of the stoma patients can become essential to patients' feeling of acceptance. Patients are more likely to accept their situation if they know their family and friends accept them. Family and friends are more likely to accept them if they understand the situation at hand. Proposed evaluation plan. In order to evaluate whether the recommendations were effective in providing nurses with essential education on patients and their stomas, the pre- and post surveys would be investigated for analysis. Another effective evaluation on education provided would be patient care outcomes. Knowledge of the nurses on stomas can be determined based on patients' knowledge on stomas. Hence, the nurses were the ones providing the education.
Additionally, we plan to monitor and evaluate quarterly reports for new stoma patient readmissions. This information would offer insight into the overall effectiveness of training programs and their effect on patient self-efficacy.
On the appendices, we have the pre-survey and post-survey where we ask how confident nurses are in their stoma care skills, if they feel that they have been adequately trained to provide stoma care, how important it is for patients to receive stoma education prior to discharge, how prepared the nurses feel to provide the effective stoma care, how prepared the nurses feel providing effective stoma education. We also have excuse me, handouts on ostomy care, explaining to patients what an ostomy is, what an ileostomy is, and colostomy, as well as how to properly empty their stomas and care for their bag. Next, we have the references, and thank you.
Thank you.
Yeah.
I am choking.
I think
my
we're still
God.
recording.
Still recording.
I stopped.
Are we still recording? I still see the sign recording.
Yeah, it's still recording.
I'm so sorry.